we're continuing on with the history of the American healthcare system. In the 1930s, the ownership of hospitals began to shift from physicians to churches, corporations, and so they began to be more similar to the types of ownership structures that we see today. Also in the 1930s, 1935 to be specific, President Roosevelt passed the Social Security Act. So 1935, we had the Social Security Act. Now, advocates for national health insurance at that time approached President Roosevelt to ask if he would include national health insurance. However, the AMA opposed the inclusion of health insurance in with the Social Security Act or with other programs that were being passed at the time. And since the U.S. was amidst a depression and had just participated in a world war, the funding for national health insurance would have been difficult to get as well. Now, you'll notice when we start to talk about other countries that after World War II, World War II encouraged the development of national or universal health care, but that was not the case in the United States. So in the 1940s, 1945, President Truman officially recommended to Congress that it enact legislation that provided national health insurance. But this again didn't receive popular support or support by interest groups. And there was another key development in the 40s. So the War Labor Board froze wages. And what that meant was it did not want to allow companies to increase wages during the Second World War. So employers were still competing to try to attract the best and most talented employees during the Second World War, but they couldn't offer higher salaries. So instead, what they did was they began offering health insurance as a benefit. And health insurance as a benefit, the legislature, Congress decided, was not going to be counted as a wage. And so it wouldn't be included in this wage freeze. All of a sudden, employers began offering more and more health insurance to their employees. And in the United States now, the majority of Americans receive health insurance through their employers. And some argue that had the War Labor Board not frozen wages in the 40s, we wouldn't have the same healthcare system that we had today. By the 1950s, 57% of the U.S. population had hospital insurance at least. In the late 40s, Congress also gave funding to the states to encourage the development of hospitals. So we began to see more hospital construction. And it was through the Hill-Burton Act that the federal government was able to encourage the desegregation of hospitals. Before the act, in the South particularly, hospitals were often segregated. And there were black hospitals and white hospitals, or white-only hospitals. But in order for a hospital to receive funding under the Hill-Burton Act, they had to abide with the anti-discrimination provision that was in the Hill-Burton Act. So, with the proliferation of hospitals and the increase in health insurance, the foundation of the US healthcare system was really put in place. And one of the key changes that occurred during the early 1900s on through the 50s, the change of the relationship between the patient and the provider. Prior to it, the relationship was much more personal, in a sense. Payment was given directly to the physician, and now we introduced what's called, with insurance, we introduced what's called a third party payer. And so when we have a third party payer, that means we have the patient that pays their premium to the insurance provider. And that insurance or third party payer then pays the physician. Now we'll talk later, the third party payer, the insurance, will likely require that the patient pay the physician a copay. We'll talk about the specifics of the relationship a bit later, specifics of insurance in another video. But suffice to say that the introduction of the third party payer changed the structure of U.S. healthcare. That brings us to the 1960s. And the 1960s was the largest expansion in government-sponsored health insurance in the United States. And that was because in 1965, we had amendments to the Social Security Act, and those amendments created Medicare and Medicaid. Oops, having spelling problems today. Medicaid. All right. So the story behind the Social Security amendments is a pretty fascinating one. First of all, there was a large amount of opposition to Medicare. Surprisingly, Medicaid, which is the more controversial of the two programs now, did not have much opposition. It was really a second thought, and it was a bipartisan. There was bipartisan support for Medicaid. It was Medicare that was the issue, and so Medicare was meant to cover the elderly, and Medicaid would cover persons who were in poverty. So, how did we get to Medicare and Medicaid? Well, there was a lot of negotiation, and the Republicans in Congress, they proposed that there be some type of insurance for the elderly that paid physicians, not just hospitals. The Democrats wanted universal health insurance. That meant they wanted health insurance provided by the government instead of a private party. A health insurance provided by the government, and it would be for everybody. But it would start first with hospital insurance for the elderly. And then as the years went on, the plan was that Medicare would be expanded. So You may be familiar with recent policy proposals for Medicare for All that have been attributed to Senator Bernie Sanders. Well, in reality, Medicare was in fact created to be expanded incrementally over time. Just like I demonstrated to you how social policy resulted in the expansion of Social Security over time to accommodate different populations that were added in later. That was the plan for Medicare at its inception. Okay. And it was the American Medical Association that actually wanted that supported Medicaid, the Medicaid portion, so, which is really surprising because now the American Medical Association is not a fan of Medicaid at all. All right, so why wouldn't the Democrats be the ones supporting Medicaid? Why was it the American Medical Association? And why was the American Medical Association vehemently against Medicare? Well, the Democrats knew that the elderly were the most politically powerful and deserving population group. And so the majority of Americans would support the elderly receiving hospital care. So if that was the group they were going to start with in order to create the program, it would be their best bet. If they included Medicaid, then what would happen is that the poor would have health insurance, the working class, working folks would have health insurance through their employers, right? Because we said that the majority of Americans have health insurance through their employers. And then the elderly would have Medicare. And the Democrats felt that this would make it very difficult politically to push for a bipartisan Medicare for all. And they wanted to just add Medicare in at a later time. However, in the deal-making process that took place, the Democrats knew that they would have to convince the Republicans and the American Medical Association, which at the time was a very, very strong lobbying group. They would have to convince them both to be on board. And so the way they did that was they ended up including Medicaid into the program, and they added in um, so that now when you look at Medicare, Medicare provides hospital insurance coverage in Part A, so that was the Democrats' initial proposal. Then in Part B of Medicare, it provides insurance coverage for outpatient care. And outpatient care is any care that a patient receives out of a hospital, so by going to the physician's office. Okay. And then Medicaid was added in. One more concession was made in order to get the American Medical Association's buy-in. And that was that Medicare would pay reasonable and customary rates of the physicians. In other words, Medicare would not set prices. Physicians and hospitals could just bill Medicare what they usually charged, and Medicare would pay it. Now, you might be confused because that's not the way it is now, but at the outset of the program, that was the deal that they had to make with the AMA in order to get them to not lobby against the bill in a way that would have defeated it. Although the plan was to incrementally expand Medicare, discussion of expansion quickly died down, and the discussion at the policy level was almost entirely about cost. So in the 1970s, most of Congress's time on healthcare was devoted to trying to figure out how to control the costs of Medicare, because the costs of Medicare were significantly greater than anybody had predicted they would be. And that was due in part to the concession that Congress had made in allowing physicians to charge their usual and customary rate. And so physicians did charge their usual and customary rate. Um, so policymakers began to explore how to control costs of healthcare. And they looked at, they funded a study by RAND, which is a think tank. And RAND looked at what were called health maintenance organizations. So I'm going to end this lesson here and give you the opportunity to learn a little bit more about the RAND health insurance experiment and the impact that it had on the development of health insurance in the United States.